Good evening, everyone. Hello.
Hello? Hello?
Hello. Good evening, sir. Good evening, everyone.
Good evening,
Good
how are you?
evening, sir. Good evening.
How's
Good
everyone
evening,
doing?
everyone. Good, and you?
We thank God. We thank God. We're going to start the program by 7:05 for everyone to join, and as well as uh the lecturer.
Okay. Thank
Please,
you.
please hold on.
Okay.
Thank
Thank
you.
you, ma. As you're in there, good evening, ma. Good evening. Good evening, everybody. I see you. Good evening, ma.
But for now. Okay, how you dey?
I did, ma. How now?
I'm fine. Good morning. Urania,
Good
good
evening.
morning.
Good evening, ma.
Good
Good evening.
morning.
God bless you.
How you do?
We dey
How do
oh.
you do?
Well done.
Good evening, Mr. Jonathan.
Good evening, everyone.
Good evening, ma.
Good
Good
evening,
evening.
sir. Good evening.
Good evening, everyone.
Good evening, sir.
Good evening. The network is bad tonight.
My apologies to everyone. We're having a difficult time to bring in the lecturer right now. So please wait for 5 minutes, 5 more minutes.
All right, sir. Thank you. Good evening.
Good evening, everyone.
Good evening.
Good evening.
Sorry for the delay. Shall we? Welcome to our day 4 of our workshop. Our tonight's speaker is an highly respected figure in natural medicine. She is a physician with over 15 years of experience in naturopathy, acupuncture, and homeopathy. She holds multiple degrees in international certificates. She will be showing us recovery tools from acupuncture to hydrotherapy. Hello?
Hello, I'm here.
I'm coming. Sorry about that. Network is kind of breaking.
Yes, but we can hear you loud and clear.
She will be showing us practice recovery from acupuncture to hydrotherapy and how they use to restore patients from stroke. Ladies and gentlemen, please welcome Dr. Gorgeous.
Good evening, everyone.
Good evening, ma.
Good evening.
Good evening,
night.
ma. You're welcome.
Thank you so much. It's my pleasure to be here this evening with. Yeah, in fact, I've been enjoying the whole thing. I've been enjoying it, though I came late yesterday, and even the questions being asked and everything, I was like, wow. I think I was the last person that left this place yesterday because I was hoping that Prof will continue from where he stopped. Oh, okay. For today, we are going to take stroke recovery and prevention through neurotherapy and other modalities of stroke recovery. So I would like to start from other modalities and then we'll end with neurotherapy because neuroacupuncture is a very wide program, but we'll do justice to it because most of them are practical sessions. Okay, let's go. I know we have been talking about stroke since this week, so I'm not really going to dwell on. Please let me get slide one. Slide one. I'm not really going to talk much, but I will still touch it because that is the key topic of this program. Stroke is the leading cause of long-term disability. Recovery requires a holistic and customized approach. Neuro-acupuncture plays a role in rehabilitation. What is stroke? A stroke is an emergency condition that is caused by sudden interruption of blood flow to the brain. Sudden interruption of blood flow to the brain. So nobody knows when it will happen. Nobody feels that or can say, if I live here now, I might be a stroke patient. That's why the word sudden. It just happens. Blood flow to the brain it's something that happens in a twinkling of an eye. And he said it doesn't have any particular person. He said this can occur in people of all ages, even teenagers these days have stroke. I've seen about one or two of them around here. But like I said here, it's more common to adults. A stroke can disrupt the communication network between the brain and the body, leading to loss of balance and coordination. For many, this results in a fear of falling, which can significantly impact that person negatively. People that have stroke will always feel that their life is finished. And the way we handle stroke issues here is like the way we equally handle young girls that that are not yet married, or that didn't get married, or that are still waiting to be married. What do I mean by this? What I mean to say is that when someone has stroke, everybody is like, hey, yeah, sorry, hey, yeah, sorry. Even the hospital will equally be saying sorry, they'll just do their own. Like Prof said yesterday, they don't really do much, but they will just, take care of the, maybe the hemostasis, balance the hemostasis, and then give drip and things like that. And the stroke patient is left with instructions of, don't use your hand, you see you cannot use it, so don't force it. Don't force yourself to use your hand to do what you cannot do. You understand? They just give them slow and killing advice. Why I said it's slow and killing is that when you don't practice with practice, they say practice makes perfect, even when you are deficient. This neuro-acupuncture it teaches us how to use that hand or that leg that is not good. Just practice it, use it small. Before you know it, you will be able to use it well. But the conventional way of treating stroke will not tell you that. They just say, okay, manage. You understand? They just give you money. You manage. Maybe they will now bring ask you to take things like get wheelchair. Just give you those aiding mobilities that would help you to sit down in one place and not do anything again all your life until the person passes on. But tonight we're going to see that it's possible for you to actually use your hands or your leg if one experiences stroke. Sorry, I want to say that I was once a partial stroke patient. I think that was 2 or 3 years ago, and I knew how God helped me through this neuro-acupuncture process. Now, please, let's go to the next slide. Next slide. Of course, you have seen what stroke is. It says brain stroke can be treated. Oh, sorry, you can see the pictures there, the hemorrhagic stroke and the ischemic stroke. The hemorrhagic stroke is when there's a rupture in the veins in the brain, sudden rupture in one of the veins on the brain, and that's hemorrhagic. And this other one you can see when there's a short cut of blood flow to the brain, that's the ischemic stroke. Please, next slide. Next slide, okay. So when somebody has stroke, there's something that is called the golden period of stroke. It's true that people don't know exactly when the thing comes, but what happens at that moment that it occurred will really give a significant help whether the person will be okay or not. Most times when somebody has stroke, the first thing they do is you carry your patient to the hospital. I want us to look at this critically. The patient is carried to the hospital, and what the nurses would do is, put the drip, or doctor would instruct them to put drip, and, they put drip and probably put 1 or 2 injections to balance the person's hemostasis. And then, remember, somebody is having a shortfall of blood to the brain, and we are putting drip on that person. We are putting water. We are putting sugar. That is water that has sugar, because drip, of course, is water that has sugar and other things. and that thing is going to the brain. How would that person recover? From experience, I have seen that that does more harm to the patient. The patient would not even if the person is to recover to be recovered in a short while, it will take that person a longer period. What happened to a stroke patient is that depending on which type of stroke the person had, ischemic stroke, blood does not flow to the brain. So what are we supposed to do? Are we not supposed to, get blood to flow to the brain, or do what to make blood to flow to every part of the brain? Well, is that not what we're supposed to do? Are we supposed to place the person in one side, in one place, and then start giving that person drip? Remember, the drip you're giving is going around the whole body, including the brain too. And everything that would have, the patient would now be demobilized by the time he finished taking the drip. If they probably 2, 3, 4 sessions of that drip, the patients will be demobilized. I will not be able to do anything again. Before you know it, they say, okay, come and carry her home. They call in a physiotherapist. They call in physiotherapist, or because they don't recognize acupuncturist because they feel that you cannot do anything. But I want to tell us that that is a very wrong practice. If somebody has stroke, the first thing to do is to open up the channels, the blood channels. The first thing to do is to open up the blood channels. Like in acupuncture, we either say you go to the ear and squeeze the ear, squeeze both ears, so that it can enable blood to flow to the brain. Anything you can do to make sure that blood goes to the brain fastly is what we are supposed to do, and not just immediately carrying that patient to the hospital. Then, by the time you do that, you now realize that the patient will just be coming back. I'm telling you what has happened to me and how I equally handle my patients. I don't encourage any stroke patient to immediately be rushed to the hospital. The person can go maybe maybe the next day, 24 hours. A stroke patient can survive. A stroke patient can survive if you do the necessary things within the first 24 hours. Within the first 12 hours. Although what I have here, I said, I called it the golden period. It says, in stroke care refers to the critical time window immediately following a stroke, where treatment is most effective in minimizing damage and improving outcomes. The period is often referred to as the golden hour, typically considered to be the first 60 minutes of stroke patient after having stroke or stroke symptoms. It says, however, treatments like clot dissolving medications can be effective up to 4.5 hours after the stroke onset. Like Prof told us yesterday, how you can use a magnet to dissolve a blood clot in the brain. Acupuncture too can do that. Even your hand, even your acupuncture, sorry, when I'm talking about acupuncture, I'm not really talking about the needles alone. I'm talking about both acupuncture aids, the acupuncture aids, things like acupuncture pen, you understand, things like acupuncture pen, magnetic sticks, and the rest of it. Can equally do things like that. Or like Prof said yesterday, there are homeopathic drugs that you can give that would, just dissolve the blood clot instead of carrying that person to the hospital at that first period, first 16 to even 6 hours of the patient's experiencing stroke. So let's go. We have a lot to do, because in anything we do about stroke, like I always say, time is of importance. We need time. Please, the time taken to make sure that the patients get stabilized is a great deal. Why? Because when it just starts, the brain cells dies off rapidly. So anything you do to recover the patient would put smiles in the patient's face. Yes, he said each minute lost during a stroke means more brain cells are deprived of oxygen and nutrients, leading to potential long-term disability. If you need to massage, I remember when I was younger, I think when I was still younger in this practice, my younger one called me and said, I don't know what is happening. Is that mommy, she can't use her leg. She can, immediately they told me that. I remember that when she was leaving, I bought her one of these massagers. And I told them, I asked them, check her BP. They checked her BP. Her BP was very high. Her BP was 200 over 150 or something like that. And remember, as you're moving that patient at that particular time, the cells of the body will just be, dying off. The person, so what I told them today, I said, please, can you get that massager and put it at this point? I told them where to put the various points of the body to put that, put the massage clips on. And after some time, I asked them to check her BP. They checked. Lo and behold, her BP reduced. It came down. And they announced, said, okay, she can now go to the hospital. And that was after about 7 to 8 hours. By the time she got to the hospital, the doctor looked at her. Madam, now you get this BP and we are able to come to the hospital. She said, yes. You see, what happened to her, why she was able to go to the hospital was because of the timely intervention that, we actually gave at the onset of the stroke activities. So time is of importance. The first 60 minutes, the first 1 hour, the first 2 hours, the first 3 hours, the first 24 hours of what we do to a stroke patient actually matters. Early treatment saves brain tissue, promotes medical intervention such as administering clot-busting medications or performing a thrombectomy can restore blood flows to the affected area and minimize the extent of brain damage. If the brain has damage, it has damage. There's nothing else you can do. So, emergency treatments of hemorrhagic stroke focuses on controlling the bleeding and reducing pressure in the brain caused by excess fluid. Okay. Now, if somebody has stroke and you just carry that person and keep in the hospital, and they will just be giving that person, drip and the rest of it. Remember, the cause of the stroke has not been taken care of. Just like somebody that has kidney issue, and the person is taken to the hospital and they are keep doing dialysis. But the truth is that it's not dialysis that is the problem. The problem of the kidney issue have not been taken care of, because dialysis is a different. So the same thing happens when it comes to stroke. When you keep your patient in the hospital and just be giving that person maybe things that would balance, normalize, what do you call it, homeostasis and everything. What of the thing that causes stroke? How is the stroke being treated? So for people that have stroke and go to the hospital and spend 3 weeks, 4 weeks, 5 weeks, 1 month or 2 months, they are increasing the damage of the outcome of the stroke that they had, because the brain, by the time they finish, the brain cells would have all gotten dead, and will now start thinking of how to revive the brain cells. So therefore, recognizing stroke symptoms, calling emergency services immediately, and ensuring timely transport to a specialized stroke center are vital for stroke patients to receive the best possible care during the golden period. I would say, as practitioners, if you are in a place where you notice that somebody is about to have stroke or is just started, you don't even wait until they bring the person to your hospital. Yes, there's a way somebody might be walking, or somebody might be, feeling walking or somehow, and you would know that something is about to happen to that person. Your timely interference would actually save that person. So we don't even need to wait till when it happens. Okay, let's go. Next slide. Next slide. Therefore, recognizing, okay, so slide 7. Go to slide 8. Let me know. So, okay, now, let's still leave it. The golden, no, please, the one before this one. No, no, no. Here. The goals of promoting neurological recovery, preventing future strokes are crucial because they have direct impact, or they directly impact a stroke survivor's long-term health, independence, and quality of life. The goals of promoting neurological recovery, preventing future stroke, because once somebody has had a stroke or experienced it, the tendency for the person to have it again is always there. The reason is because what the person might not remember, you understand, to abate or to correct what actually caused the first one. Like we had yesterday, if your cholesterol is okay, if your cholesterol is always okay, and your BP and your blood pressure, the tendencies to have stroke, it will be minimized. So if you think that you have had a stroke episode before, and you then relax, not checking your BP or taking your necessary cholesterol and BP control, the medications, herbal medications, or whichever you decide to take. Like, I don't stop patients from taking their normal BP drugs. I don't do that. The reason for that is, yes, we have our alternative or complementary BP drugs, but most times when you stop a patient from taking their BP drugs, if anything happens to them, they will not be able to take it the way you instructed them to take it. If anything happens to them, they will say, this is my new doctor, so I cannot take them, and they will start blaming you for whatever. So what I tell them is, you can take your conventional BP drugs, take it maybe 2 or 3 times in a week. That's what I tell them. So if you have had a stroke episode before or incident, and you forget to always make sure that your BP and your cholesterol is at a good level, the this of having back stroke is there. The tendencies to have back that stroke is there. And again, remember, when you stress yourself more than necessary, because apart from the cholesterol and BP, and there are other things too that can lead to one having stroke. So make sure that you teach your patients, to stay on their drugs for those that have had stroke incident before. How to prevent stroke? Can we prevent this thing called stroke? Can we actually prevent it? Somebody said it runs in my family. Yes, it's genetic, I know. But the truth is that when you do what your parents didn't do, you will not have it. Yes. Our parents probably might not have the knowledge that we have today. They might not, have they know so many things that we know today. They they don't know. So for the fact that you have this knowledge, you're now we are talking about eating well. Now we're talking about blood group. Now we're talking about so many things, that could aid you to be healthy and not be sick. Our parents then didn't have access to it. So you can rewrite, the genetical diseases that runs in the family. You can. You can say, oh, my father used to have BP, or used to have what do you call it, sugar. Okay, me, I've learned how to control my sugar. I've learned how to avoid things that will make my sugar to go up. And if you stay on it, the truth is that you will not have the what do you call it, the diabetes, or you not have the BP because you're better informed. So it's possible to prevent stroke by doing what? Controlling your blood pressure and your sugar level, knowing the things to do. And then regular neuro-acupuncture maintenance. And you ask me, say, I've not been a stroke patient, a doctor. And for people that have not been a stroke patient, how do they do neuro-acupuncture for themselves? It's possible if you have the knowledge. Each morning when you wake up, you just put your hands on your head and massage every part of your head, because me and you, I know I'm talking with people that are practicing to practitioners. So me and you know that every part of our body is equally represented on our heads. Yes, every part of our body is represented on our heads, just like we know it's equally represented in our hands. That's what acupuncture can do. So you can wake up early in the morning. First thing you do, massage your head, massage it very well. You're opening the veins everywhere. You're just opening it for proper blood circulation. So that one is possible. Then stress management and adequate sleep can equally enable us to prevent stroke. A lot of us don't even sleep. A lot of us don't, we don't know how to manage it. I'm happy that I'm talking with practitioners because I happen to equally be one of them, and I'm equally guilty. You understand? Because most times we think that these things are for our patients. You don't sleep, you don't, we advise them, but how much time do you give to yourself to rest? And by the time you finish and come back to the house, you're just tired and just eat anything you see. Remember that your system is counting everything that you put inside, whether you eat well or not. It actually counting it, and that is the truth. And the other one is regular physical activity. Regular physical activity, which is like exercise. Exercise. Some of us, it's good to drive, it's good to have a car and the rest of it. But at times we equally need to walk. Walking is an exercise, a very wonderful one. Exercising your feet and in fact, your whole body, everything. Then healthy diets and staying physical active. Next slide, please. Next slide. Let's go. Next slide. Next slide, please. Hello. Hello. Can you hear me?
Yes,
Hello.
ma'am.
Yes, we are hearing you now.
Okay.
Network is too poor. It's breaking.
It's too poor, and it's raining here. Network is poor, it's raining here. Okay, let me have the hydrotherapy, the slide 9, please. Slide 9. Okay, so we are going to start with the first one, hydrotherapy, as one of the modalities to stroke recovery. One of the modalities to stroke. I might not be reading everything, but I'll just so that we can meet up with time. Of course, when we talk about hydrotherapy for stroke leverages the therapeutic properties of water as a valuable tool in stroke rehabilitation. The unique properties of water provides an effective environment for exercise healing, making it particularly beneficial for the population. This involves the use of water in various forms. Now, how does it work for a stroke patient? If a stroke patient can be taught to swim, a stroke patient equally can. There are a lot of people that doesn't drink water. They have dehydration, and you know that is not equally good for the system. So now hydrotherapy is making the patients use water in various forms, both apart from drinking, swimming, you understand, and even fermentation. You can equally do what is called hot and cold bath. So hydrotherapy has to do with the use of water in different ways to effect treatment. Like there's this one that we usually do when you wake up in the morning, taking water. You know, there was a time in School of Thought came out and said you wake up in the morning and you drink warm water or hot water. Warm water. For some people, they drink hot water, some people they do. But recently, I equally discovered that for those of us that are on the slim side, it's not really good for us. Just take your normal room temperature water, you're good to go. That is the truth. Because you know, when you drink hot water, you know what? Yes, it helps for proper blood circulation. But for people that are like blood people that has blood group O, which of course their blood is very light. Remember, they have their blood is thin because that hot water you're taking is equally to thin the blood so that blood circulates freely and very well. So that school of thought has not looked at this other aspect. So hydrotherapy can help a stroke patient. Make sure you drink a lot of water so that the digestive system is flowing the way it is. Because one thing that I found out that stroke patients usually have is they're highly constipated. Yes, they are mostly highly constipated. And what causes that, I think most times is because they are when one is not drinking water, the food you ate is not digesting, or it's either they ate late and the food does not digest, or the kind of food they ate. I don't know, but they are always highly constipated, which is not good. So it makes the whole system stocked up. So, of course, the stroke patient can swim. You are seeing when the patient is you teach a stroke patient how to swim, the person is, you know, taking giving activities to every part of his or her body. Okay, like the picture you're seeing there, see the woman in the water, both of them in the water. You know, the water is equally releasing its energy into their system. Because when you stay in a swimming pool or in water like this, you have the ability to move any way you want, whether left, right, unlike when you are not in water. When you're not in water, and you know the weight of the water equally helps you. The weight of the water equally helps you. The buoyancy of the water helps you to stay afloat. Like the second picture you see. Imagining that this man had stroke and he's doing this, why won't he get well? He will definitely get better. Next slide. Benefits of hydrotherapy for stroke patients. It increases mobility. resistance training, cardiovascular conditioning, the exercise there, helps the muscles and everything that is in the body that is restricted. The water just pushes everything away. Cardiovascular conditioning, pain management, balance and proprioceptive training transition to land. Balance and proprioceptive training and transition to land. Hydrotherapy. How it works. Temperature manipulation influences blood circulation and immune response. Buoyancy reduces joint stress, making it ideal for rehabilitation. Assuming the person cannot, the stroke that happened to that person affected the lower limb. By the time the person swims, it will make the leg to be very more, at least to be very flexible. The person can move it. The person is even having pains. Remember, most times, most of these swimming pools have salt in them. So you see, the salt in that water has been able to push out everything inhibiting the patients from exercising. And then the detoxification and circulation there. So let's go to the next slide, please. Next slide. Next slide. Next. Of course, we can see how free. These patients, these are stroke patients. It says how to swim the front crawl stroke. How to move forward when you're swimming. Every part of the body is involved. The hand, the leg. It says extend your arm straight down. There's nobody that will finish this kind of exercise as a stroke patient. So I know somehow some of us will be saying, how is it possible for a stroke patient to go this mile? But it's still possible depending on how that stroke patient was handled at the initial time. Okay. Now we'll go to massage. Sorry, now I'm rushing this part because we still have a lot to do in the neuro-acupuncture session. So that's why I'm just trying to go through these other ones. Another modality that we have to talk about is a massage. Massage. There are various forms of massaging, but from this workshop, from this paper, I will equally know the ones that to suit a stroke patient. Some years back, there are this kind of massage. If somebody has any issue, and they are taking to the jaw women, honestly, I respect them and they are doing their job very well. But by the time they finish massaging the stroke patient, the patient will be worst. Yes. And I don't know why it happens, but I think it's because they are not really trained. That is why some doctors will tell you, don't take your stroke patient to any massage center. Because the technicality of doing the massage and how they are not taught, they are not learned. So for them, massage is when they use their energy and pull on your muscles. Your hand is not, you're not moving it. Okay, they will pull it in a very hard way that you even shout. I have seen somebody gone for massage that had stroke, and up to date, the person had never recovered from using that part of the body that the person had the stroke on. I have seen it. It happens a lot of time. But that's not true. Massage is one of the best tools too that can recover a stroke patient if actually is done the way it's supposed to be done. After a stroke, The aftermath is not always the same for everyone. There may be some paralysis, weakness of the muscles, difficulty with speech or memory loss. So, whilst massage cannot really help with the later two, that is the memory loss and the speech, it can undoubtedly have a positive impact upon both the paralysis and muscles weakness. Yes, hence, neuromassage is a vital aspect of a stroke treatment. I told you how even without having stroke, every morning when you wake up, you just put your two of your hands on your head and just massage every part of your head. Neuro massage. You're helping yourself to make sure that blood circulates to everywhere. So the same thing happens to a stroke patient. That's why I said the people that massage and the stroke patient doesn't get themselves are people that are not trained or they don't know the parts to massage. Neuromassage is a vital aspect of stroke treatment. Massage therapy can be beneficial for stroke patients in several ways, helping to improve overall recovery and quality of life. Let's go next slide, please. Okay, like we can see. First of all, I want us to note the picture in the second row. The picture in the second row, the one that shows the feet. That shows that one shows you every part of the body. It tell you that every part of the body is equally presented on the feet. Like I told you, it's in the head and it's in the hand. I said that is what acupuncture is all about. So now, by the time somebody has stroke and you're able to go to the feet and massage, look at the feet and know where the brain is and everything, and just a gentle touch. You could use your hand, you could use a massage pen, or you could equally use needle. Why I don't really subscribe to needle is that a lot of people are afraid of needle. Even practitioners are afraid of handling the needles. A lot of practitioners, they say, no, Dr. Gorgeous, if it comes to needle, no, I'm not in. But I tell them it's not even difficult. That is why you went to school. It's not difficult. You just to know the right place to place it, and they say, oh, okay, right now we are no longer using needle. Is not a must. So it's something you can do with your hand. It's flexology. It's something you can do with acupuncture pen. Is it even something you can even treat a patient? I treated the patient with what do you call it, with biro. Yes, I treated the patient with biro with pencil, because all you just needed is that the mouth, that sharp ending of that pen or the biro or the whatever you decide to use. So as being now that you're massaging a stroke patient, and if you watch, see the gentle, this one is applying a gentle touch. They are not, is not like the one that we usually get when we have when we go to the Joe woman out there. No, just tender. The second picture in the first row, just I can even feel the way the man is just pressing. See, just tenderly running through the whole veins, opening up the lymphatic vessels, everything, so that blood can flow and there will be proper recovery system for the patient. Next slide. Benefits of massage. Massage improves massage therapy enhances blood flow, which can help reduce swelling and promote healing in affected areas. Of course, if you bring your hand now and you tie your hand, the truth is that the next thing you feel in the other part of your hand is pains. So which means that there is a blockage. So by the time you remove that thing you tied in your hand, the pain will go, or it will reduce drastically. So massaging for me now in this illustration I gave now is that removing you're moving the whole arteries, the whole veins. You're just just gently doing it so that the patient would same thing can be done for a stroke patient, because even a stroke patient doesn't need strong hand. No, that is the truth. It doesn't need that or energy. No, it needs just small getting out the veins, line by line, and blood will you can even see it. You just see that place, the veins aligning. Muscular relaxation. Stroke can lead to muscular stiffness and spasticity. Massage helps to relax tight muscles, reducing discomfort and improving mobility. Pain relief. Many stroke survivors experience pain, whether from muscle tension or neuropathic pain. Massage can alleviate pain through the release of endorphins and by reducing muscle tension. Next slide. Next slide. Let's go. Let's go. Next slide, please. Massage techniques. Massage techniques. Massage techniques. The first one here says elfurage. Elfurage massage, like I've been emphasizing, has to do with gentle gliding strokes to warm up muscles and improve circulation. I suggest, I don't even think we should wait to have to experience stroke or so before we advise our patients, to always go through this elfurage massage. You can be talking to somebody and you're gently massaging that person. That is the truth. In fact, I think this elfrage massage is another word for it is love massage, tender love massage. Yes. So now, by the time your stroke patient goes through this every day, you remember the stroke patient is battling with the emotions of the situation he or she is experiencing presently, and each time the patient visits you, just give that patient this kind of gentle gliding massage all over the system, or maybe in the hand, depending on the area that was affected. It helps from muscles from waking up the muscles, bringing up the muscles, and equally improve circulation. Then the second one, kneading and lifting the muscles to relax tensions. Kneading and lifting the muscles to relax tensions. That one is stronger than the first one. Yes, because you're pulling. You pull and you drop. You pull and you drop. You pull each part of the muscles based on where you're working, the area you're working on, and you drop. It makes that place to be very flexible. Then remember, it says be mindful of bony prominence. Avoid direct contact or direct pressure on bones and joints. Avoid it. So let's go. Like I've not gotten to this side. Okay, consistency is the key. What am I? What do I mean by this? What we are saying here is that communicate with the patient. Regular check-in with the stroke patient about their comfort level and any pain or discomfort they may be experiencing. If I tell you the truth, let me tell you the truth. Stroke patients are they usually go through a lot of emotional trauma because of the traumatic cases they found themselves in. Honestly, most stroke patients feel abandoned. Notice, if somebody has stroke today, that first time that the stroke occurred, a lot of people will visit the person. As time goes on, everybody will abandon the person. That is the truth. So the stroke patient is left, is left to taking his or her life in her hands the way she wants it. Visitors will never come to visit that stroke patient again the way they were visiting initially. They don't. So, as a physician to a stroke patient, constant communication is very good. I mean, from time to time, how are you doing? I hope you're doing well. You're okay. Positive vibes would equally help to increase the person's morale or raise the person's morale. Positive vibes. I just called to see to know how you're doing. I'm sure you are using that your hand to eat now. Try it. Use your hand. Try. And he will say, no, it's paining me. No, it's you. No, use it. By the time you use it, you continue using it, you see it will not pain you. There are a level of confidence that you can give to your stroke patient that would even make her to, get up to the challenge of whatever it is. I put my heart to this thing. I'm going to be well. But there are some patients that no matter what you do, they are discouraged simply because they are not working, simply because they are deformed or one way or the other because of this thing that happened. So there are some patients too that you work on and they will follow you and they'll still get well. They'll be recovered by your consistent care and love. So let's learn how to, follow up our patients. Constant. Next slide, please. Okay. Friction circular or fiber movement to break down adhesions. This talks about techniques of massage too. Then the other one, rheumatic tapping or percussive movement to stimulate muscles and nerves, range of motions, combine massage with gentle movement. Range of motions means the speed or the speed or the speed at which your patient is able to either move the hands at a particular time or move the leg or any other aspect of the person's body that is affected. Next slide, please. Next slide. No, 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 no. The yoga is there. After we have yoga. We have yoga. Okay. Yoga incorporates techniques to focus the mind and promote mental clarity, reducing stress and anxiety. Okay. Can I tell you honestly, before I entered this practice, I used to think that this thing called yoga, it's I used to think that it's demonic. I would say, I would tell myself, I say, why would somebody just sit down and be, looking up or looking down or just like that, communicating with who? That was my impression about yoga. And, and we heard that stories of somebody was performing yoga and his spirit is connected to one spirit out there. And by the time the person goes away, the person can stays there and for maybe for how long, and before you know it his spirit flies away. All those stories and tales that we heard them about yoga. So there is this fear that if you stay like this for hours you'll be communicating with some spirits that you don't know, unknown spirits. But thank God for knowledge and thank God for uh, complementary and alternative medicine. Thank God for the things that we have been able to learn, that yoga is not what we think, but yoga is mindfulness. You know, on your own, talking to yourself, being on yourself, and it's a time you look at your life and think about how to rearrange your life, or think about how to attract energy, positive energy within you. So he said yoga incorporates techniques to focus the mind and promote mental clarity and reduce stress and anxiety. Permit me to say, for some of us that are here that are Christians, for me, yoga is even another time of my relating with God in my practice, and Him telling me what I should do for the day. That is the truth. Because your mind, everything you are doing is focused. You're focused. You're not thinking about anything. So your body, everything is coming together. And like benefits of yoga he said it improves physical health. Yoga can increase strength, flexibility, and balance, and may help conditions like pain and arthritis. Yes, because you're just there. It's only your mind, your spirit that is that is functional, that is doing it. I don't know how to express it. So when you're not doing anything, you're not stressing yourself, you're just alone, thinking of getting clarity, and taking positive vibes around you, it will definitely make you to be healthy. And spiritual growth too. Like I said, for me, this is the time I spend with God. When I do my yoga, it's when I spend with God. I'm asking what's next. How can I go? Or when I have a patient to treat. I usually use that time to get focused and know the direction of treatment I'll have to give to my patient. Because most times our practice is not just academically empowered. No. Your relationship with God, your relationship with God and your spirit equally, gets the link of what to do to your patients, or get the information. There are times you might be confused of what to do, but you know that when you are alone, you just see the thing just flowing in. Okay, do this, do that, do that, do that, do that. For that stroke patient, you are giving enough ginkgo. You don't need to give too much. Okay, go and instead of ginkgo, go and look for lecithin. You understand? It's just before you know it, and it just keep coming, and you're writing that. So for me, that is what I term as my own yoga. So there's something we call a therapeutic yoga, because this yoga, probably people will learn it from the Indian. We see them do this thing, but we equally see them do mighty things after they finish doing this yoga. Yes, when I say doing mighty things, we see them having enough wisdom, enough knowledge to carry out the activities. So therapeutic yoga is a specialized form of yoga that forces. Please go to the second next slide. Therapeutic yoga. Go. Okay. Therapeutic yoga is a specialized form of yoga that focuses on yoga practice to address specific health conditions and promoting healing. It goes beyond general fitness and wellness by tailoring yoga to an individual unique needs and ailment. Therapeutic yoga. So what am I saying here? What we are saying here is yoga can help a stroke patient by different positions. There are different positions one patient can take depending on what is wrong with that patient. There are different positions. When you get the slide, you can read it up. There are positions there. But like you can see in this diagram, you can see how this woman, how she positioned, and look at, when you look around her, you will see different areas, different illness that this thing, by simply doing this position, this one that you're seeing here, you can see it takes away anxiety, it takes away headache, it takes away shoulder pain, it takes away neck and knee pain, ankle pain, arthritis, sciatica, back pain, and what have you. Stroke don't go now. By doing this alone, stroke has gone. But you will say, but which stroke patients can do this? By gently encouraging your patient that, she can get back all her functionality, everything that she lost. A time will come when your stroke patients can do this. That is the truth. Okay. So let's go. So now, this is the main thing. This is the main thing. Neuro-acupuncture. Neuro-acupuncture. When we talk about neuro, what is neuro? What is neuro? What is neuro? Go, please, next slide. Okay, please go to the next slide before this one. We'll come back to this. Next slide before, no, after, sorry. Next slide after this one, where you have the blue, I think it's slide 32. Oh, good. When you talk about neuro, you're talking about nerves. So neuro is nerves, and when you have a lot of nerves combined together, we're now talking about neuro nervous system and the rest. Dr. Daniel did a very good work on this on day before yesterday, no, Monday, when this program started. He explained about the neuro nerves, sinuses, and the rest of it. So I'm not going to go through that, but it's just to show you, of course, what neuro is. He said neuro is a prefix referring to the nervous system or their studies. It's used in various medical scientific terms, particularly within the field of neurosciences. Nerves. Neuro relates to nerves. Yes. So when there are a lot of nerve cells, all of them together now turns to the neurons, and network of nerves that transmit signals through the body. It's like wire. Well, I would like us to see this thing when we talk about neurons and nerves. And I would just like us to look at a circuit board. For those of us that did engineering, it has different angles. It has different wire connecting. The same way the brain is, these things could be seen as wire connected to the brain. That's neurons. So if anything happens to one of it, it affects the whole system. If anything happens to two of it, in fact, the whole system goes haywire. So it says it encompasses the nervous system, encompasses the brain, the spinal cord, and all the nerves extending from them, which controls bodily functions, thoughts, and movement. And now I have a question. My question is, when we talk about stroke, we usually go to treat that problem called stroke where it did not originate from. Somebody had stroke and is part of his legs are impaired, and we go to the leg and start massaging the leg, start doing something to the leg, hoping and wishing that the person's leg would be restored. Please, what's happening? The slide is not there. The slide is not there. Hello? What's happening? What's happening? Hello?
I think
Hello?
it's network
We are
issue.
hearing
I
you.
guess it will
We are
come back.
hearing you.
But you can continue with the meeting
Okay, you're
now.
hearing me. Okay, fine.
You can
Okay,
hear.
like I was saying.
We are hearing
Okay,
you.
like I was saying. Okay, like I was saying, you know, somebody had maybe one of the hands were deformed due to a stroke attack, and you're pressing the hand and all those stuff. For me, it's not proper. We are looking for the solution. Where the solution is not, where the problem didn't come from. Like we just read, the anything that has to do with the body is controlled by the brain. It's controlled from the head. So we should be able to go to where the problem started from and take care of that problem. We should not be looking for where the ashy point, where we call ashy point in acupuncture, where the problem didn't originate from. Yes, something happened in the brain. That is why the person is not able to talk again. Something happened in the brain. That's why the person is not able to move his legs. So we should look at it this way when we're looking at neuro-acupuncture. We go to that place where the problem started. Yes, a part of it had issue, but we should be able to knock around that area, touch that area to see if that part of the brain that was damaged, if the person can, enter through the other side. What I mean to say is that when you talk about neuro acupuncture, you're just trying to walk around. It's just like you live in a compound, you understand, and your door is locked. But you have other people living around you. Maybe somebody locked your door and took the key away. You can go and ask your neighbor, please, did my sister keep the key to my house in your place? Oh, I know, but I think I have something that looks like something that can open your door. That is just what this neuro acupuncture or neuro whatever is talking about. Playing around the brain, playing around the place that the problem that is happening physically, where it originated from. Just go back there. You don't tell your patient, no, your patient can, okay, her hand was affected. You see, this hand you cannot use it alone. Just don't bother. Don't bother using it. Just be using the right hand. Now, since the left hand was affected. No, you can say no. You see, we'll walk around it to see how you can, be using that right hand, even if it is to use it and lift up something that is not as heavy as how you would have lifted up when the hand was okay. No, you can still manage to use this leg by doing what? By going to the place where the issue started and knocking at the door of other other nerves that is around there. I hope I'm making sense. Hello?
Yes, yes, ma'am.
Okay.
Yes,
Okay.
we are
Yes, ma'am.
hearing you. We are
Yes,
hearing
ma'am.
you.
Yes, well,
Okay.
yes, yes.
So the picture here is not what is not. Please remove that picture. I've not got it to that. I'm still on that blue one. I'm still on it. Please go back, because I want us to understand this thing very well. So nervous system encompasses the brain, spinal cord, and all the nerves extending from them, which controls bodily functions, thoughts, and movements. Have you seen it? That the person is not able to move. It's because of what is happening in the brain. Because of what is happening in the brain that the person is not able to talk well. Is because of what is happening in the brain that the person is not able to in fact, the person doesn't think. He just opens his mouth and saliva is just coming out. It is working it has to do with the brain. So neuro-acupuncture is another way of doing what? Now, if you understand acupuncture is, inserting a fine needle, call it needle, fine needle, into a particular meridian or into a particular hollow of the body to effect treatment. Acupuncture, you're puncturing a particular place to effect treatment. So now, when you now come to neuro-acupuncture, you are equally, trying to either you can use your hand, you can still use the needle, or you can use an acupuncture pen. So just, tap, just tap at around the area where the stroke is coming from, which is the brain. So simply it's telling you that instead of doing what we call Adichie point acupuncture, Adichie point acupuncture is going to the place where the issue was done. You do what? You go to the brain and locate where that particular body is represented in the brain and do your treatment from there. That's what it is. Now, next picture, please. Next picture. Next picture. Can I have the next picture? Okay. Next picture, please. You
I
need
guess
it.
it's network.
Oh, Jesus. Because I need this next picture we need to see it so that you will. Oh, what is happening? What is happening? Okay. Oh, okay. Thank you. Now, no, that picture, please. I need the picture. I need the picture, please. Okay. We have seen the picture. That's the picture of the brain. That's the brain. Like you have seen this place you see the arrow is just the only part that treatment is being done on when we have a stroke patient. Now remember, there is something that is called contrary side of treatment in stroke. What that simply means is that when you have seen your patient's results and it is the right leg, right side, right hemisphere, or whatever that is affected, you treat the left. And when it is the left that is affected, you treat the right. The other side of the body that is not affected is simply supplying blood. You understand? To the other side of the brain that is okay. So the other side of the brain that is not affected is supplying blood to the other side of the brain that is okay. So that is why you have to treat, use contrary side treatment, because if not, nothing will happen. So like you have seen, we have now, there's a picture I want us to, anyway, we have the motor cortex, we have the association cortex, we have the broadcast, we have the sensory, we have the association cortex again, we have the visual, we have the cerebrum and auxiliary cortex, and all you're seeing here is everything that is represented in the brain, the areas where they are located. As we go on, I will now tell us how to use either needle or your hands or whatever to effect stroke treatment using this particular picture. Now, like I told you, I said that somebody is not talking well. Somebody had a stroke incident which affected his speech. Can you see that speech is equally from from the brain? Yeah, that's where that area where you have the broadcast. Reasoning from the brain. Eyes, visual. So the brain controls virtually everything that happens in the body. So no need of going to look for the treatment where it is not found, because it's because of lack of knowledge of this neuro-acupuncture. That's why a lot of people stay on, they experience stroke and they never come out of it, because the only thing that is giving them is injections, maybe our herbal supplements or supplements, and most of them even dies by taking too much of those supplements. It's not doing anything, simply because the place where the problem originated from, nobody has touched it. Yeah. Having taken us through all the modalities of recovering a stroke patient naturally, we talked about massage, we talked about water hydrotherapy, we talked about yoga, and others that you have been hearing before now, because I know that this program started on Monday, and so they've been dishing a lot of recovery modalities that can cover stroke. So it's my joy and pleasure to introduce this last and latest modalities that in recent times has enabled a stroke patient gain back their confidence and equally place a sense of personal responsibilities of their recovery process in the hand of the what I'm saying here is that stroke patients are trained to leave everything about their life to the doctor. Look at it. If you had stroke patients who cannot talk, who cannot walk, who cannot do anything, everything will be revolving around you or around the caregiver. But neuro-acupuncture had been able to make us know that we can teach the patient to use the word. We can do some things. We can go to the brain and effect some treatments. One or two things. Tap it. The electrical waves will just trigger the hands to move, or trigger the leg to move, or trigger the part of the body that is affected to start working. So it is not the patient, the doctor again, that would be taking care of the patient. The patient even have it as a responsibility to always touch there. Most times, at times I teach my patient, I said, do this, do this. You can do it yourself. Don't use needle. Use your Bible. Touch here, touch here. At times I teach my patients that. And you can see that they can even help themselves, to go beyond what they have imagined before that they cannot do. Because inside that, we have a lot of stroke patients, but the inability of them doing what they should have done for themselves is what is the problem. Now, when you want to treat somebody that has a stroke in using neuroacupuncture, these are the questions you have to ask yourself first, or you have to know as a therapist. What is the damage inside the brain? What is the damage inside the brain? I don't know. I think I will have to ask Prof this particular question later. Those people that have stroke that they carry, that has a hemorrhagic stroke that they carry to hospital, and the first thing that is done to them is to give them drip. What happens to those blood, that was clotted? I don't know whether we have ever thought of it or imagined, but I'm telling you what I asked myself at times. We can excuse ischemic stroke because for all we know, ischemic stroke is not as bad as hemorrhagic stroke. So we can excuse them for that. But this one that blood is gushing out from the brain and you're equally giving drip to the patient, I will ask, call for one day and ask me, I say, what happens? Does it mean that the doctors does not understand what damage that is done in the brain? So as a therapist, you should equally know, first of all, what happened, what damage, what is it, hemorrhagic, is it ischemic, or is it tertiary, the other one, transit whatever stroke. So, and then what is the outcome of the treatment you are about to administer? The drip you're giving, what is it supposed to do to the stroke incidence? Will it move it forward, or will it make it worse, or will it keep us still where we are? Then, what is the progenesis of the stroke? Diagnosis. Has the person known the reason why the stroke came? Is he having blood pressure, or is the cholesterol high? All this you should know before you come out to do, to touch somebody's brain. Then, what treatments have you decided to start with first, and what should be the likely outcome? This is how we plan our treatment so that we can get results. And equally, I think this equally applies to when you're equally giving homeopathic remedies too. Some of these things here applies to it. You should be able to know what the result of what you're giving, what it would result in, what you get, the outcome. So when I gave the first treatment, okay, I had a stroke patient, I did this, I did that. After that, this was what happened. Like I've had a stroke patient that what I did, of course, she was rushed to the hospital, quickly rushed to the hospital, and they put their drip on her. But of course, she believed in me. I went to the hospital. I slept with her in the hospital for one night. While they were doing their own, I was doing my acupuncture. I had already mixed my homeopathic drugs in water, that looks like regular water. So it was white. You wouldn't even know that anything is there. And before 2 days, she got up from her bed. So I knew what I gave her. I equally knew the physiotherapist would equally, he came and used his TENS machine and did what he did and so on and so forth and left. Me and you equally know that the TENS machine, okay, we know the level of impact it's going to have on that patient at that time. But I did my neuro-acupuncture on her. Each time I would remove her net, whatever she used to cover her head, and I would massage her head, massage. She got up the following day. We spent only 2 days in that hospital. And the husband had to ask for discharge, and we went home, and then we continued the rest. The truth was that in 3 months' time, this woman was able to walk. In less than 3 months, she was able to stand up and started walking. So that is why this area is very important. If you know that the treatment you're going to give to your patient is not going to result to a positive outcome, please don't start it at all. Don't. Just wait until you've gotten something that would move our patients forward. Now, have you ever heard the saying, neurons that fires together, wires together. Neurons that, it's just like saying uh, uh, a friend, is it a family that plays together, lives together, or whatever? A friend that sticks together, that behaves the same way, stick together. When you know, circle of friends are always sticking together or behaving the same way, you always see them. You know, each time they are together, each time they're together because of their behavioral pattern. Neurons that fires together, wires together. Like I told you, I said this brain thing looks like a circuit board where you have ICs laid out. For those of us that are engineers here, ICs laid out, you know, those ICs that are laid out there are interconnected to be able to bring up one particular function. Go and touch any of those ICs. Please, we have left this. We have okay, you're hearing me anyway, because the picture there is I'm no longer there. So go and touch one particular IC, and you now see the physical effect it will have on that circuit board. The same thing is happening here. So the same relates to the concept of neuroplasticity. When you talk about neuroplasticity, it's the way the brain changes throughout life to adapt. You see, it can learn. Plasticity has to do with learning of a new thing. The ability to do what you cannot do before by gathering the momentum around you, or gathering forces that are within you, your environment, to add to what you have, so that you can be able to do what you cannot do before. Yes, this strength that I have to do this now, I don't have it again, but I can borrow strength from A, I can borrow strength from B, I can borrow strength, the more I borrow and take from each of them, the more I'm able to do what I am not able to do. So plasticity, the word plasticity is helping to expand your horizon of operation. Neuroplasticity is the way the brain changes throughout life to adapt, learn, and recover. It describes how our experiences can recognize and develop new neural pathways in the brain. New neural pathways discover this place is affected by the cells has died. But are there other lively cells or living cells around the area where that dead one is located? Yes. Then let me work with that one. Let me make friends with that one. And by the time I stick to that one, I will discover that I am beginning to have some functionality. I'm beginning to do some, even if it is small, of the things I'm not able to do before. So when we learn things or memorize new informations, we create lasting changes in the structure of our brain. Remember, before now, we are just there. What happened? The person had stroke. I don't go massage. I don't go hospital. They say I no go fit use my hand. So everything is just there like that. So my life is, so the person is just waiting till the day he or she will die. And nurses or doctors or whatever, still support them by making them feel that they cannot do anything for themselves. So, but no, that's not the case with neuroplasticity. Neuroplasticity gives the patient hope. If Mama Paulina no dey, Mama Paul dey. So that maybe things, let's be moving. Let's be moving. And that is how the idea of neuroplasticity is able to, help a stroke patient to get better. At least, like I said, it might not be 100 because I heard somebody asking Prof this question yesterday. That does it mean that since we give somebody herbal medicine or whatever, does it mean that a stroke patient can never be recovered fully? A stroke patient can recover, but I'm telling you, it will not be 100% the way the way he or she was before. Let's not, because all the person's life following the neuro-acupuncture system, the person will keep learning and keep learning of how to bring up positive outcomes. Keep learning, because whatever you learn, you continue to practice. And remember, practice makes perfect. By the time you practice how to, oh, they said I should not use that leg. I should be using the one that is okay. But remember, you're overloading the one that is okay. And before you know it, that one that is okay will come down. So let me start using this one now that is immobile, by what I am taught, what I'm being taught. So by the time you're using it, gradually, you always get better. You always get better and stronger. So when we say that stroke patients, it's not that they cannot recover, but it will not be 100% the way he or she was before the person had the stroke. Let's name it, please. And so that will make you to tell your patients to, keep practicing, right? Because the truth is that some of them, when they see that they can move their legs, I can move now, I can talk now, they just relent in doing the things that they are doing. They just relent in practice, doing the exercise. They just relent in, doing their neuro-acupuncture practice. They just stop. And when you stop, you of course you know what to expect. Next slide, please. Next slide. Next slide. Next slide. Types of neuroplasticity. Admin, structural neuroplasticity. Structural neuroplasticity is when the brain structure changes because of experiences such as learning. Structural. While functional neuroplasticity is when the brain functions move from one damaged area of the brain to another. When the brain functions move from one damaged area of the brain. So this tells us that what we are learning or what we are doing is what we call a functional neuroplasticity. When the brain functions move from a damaged area of the brain to another. When this part that can make me to see or to talk or to do something is damaged, and I say, okay, let's try if this other one can help me to equally do the same function. That is what functional neuroplasticity is. Three common aspects of neuroplasticity. Age. Who is there? Who is there? Admin. Neuroplasticity, the brain's ability to recognize itself by forming new neural connections throughout life, is crucial for stroke recovery. It allows the brain to compensate for damage caused by a stroke, creating new pathways and connections, enabling stroke survivors to regain lots of functions like walking, speaking, and performing daily activities after a stroke. Neuroplasticity enables the brain to reroute connections and connections around the damaged area, especially creating new pathways by bypassing injury and restoring functions. Okay, now let's look at this picture. Let's look at this picture here. Oh, hello, are we there?
Hello?
Yes,
Yes,
we are
ma.
with you.
But I
Well, I'm
need
here
that
with you.
picture. I need that picture. I need that picture. Go to slide 40. Good. So now this is this is this is the boom
Yes,
how
sir.
to treat on how to treat a stroke patient. Like you can see the anterior and the posterior pictures. Every part of the body represented in the hands. Every part of the body presented in the hands. I don't want to start taking you through, the other one that you talk about the motor cortex, blah, blah, blah. This is the one that is very unique and simple. For this is what I use. Like, of course, you can see that the thumb represents the leg. It represents the left leg, depending on where you are staying, on how you're seeing it. Then the small finger represents the right leg, depending on how you are seeing it. And then the middle finger represents your face and your, your stomach, colon, down to your pelvis. Yeah. Then the ring finger represents your left hand. The this other finger, this other hand rather, sorry, this other finger, yes, now index finger represents your right hand, or represents the patient's right hand. Now, if I have a stroke patient, what I simply do is take my hands like this now and place on the patient's head, starting from your hairline. By the time I place my hands on the patient's head, I am seeing where to put my needle, assuming it is the leg that is affected. I will put my needle at the, what do you call it, at the thumb. Are you following? Are you following me? Hello?
Yes, ma'am. Yes, ma'am. Yes,
If
ma'am.
you
We're
place
following.
your hand now, starting from your hairline on your head, you'll be able to get the picture. Just place your hand. As you place your hand, wherever that your hand stops is where to manipulate your patient that has either the right side stroke or left side stroke, or rather different, depending on what is not working. If I place my hands on my head, either my right hand, especially my left hand, if the person has a right-sided issue, I'll just put my needle at my small finger, the person's legs. The person would start moving the leg. That's the truth, and that I've used it severally. If it is in the left, I put my needle, the place where my thumb finger ended, and the person would start lifting up the other leg. And if it is in the hand,
In the hands, I will either choose, depending on the hand, I will either choose to put my needle in either needle. I said it must not be needle. It must not be needle because a lot of people don't even know how to use the needle. The needle, is something you don't put straight like that. No, it doesn't come straight. You do 15%, sliding. You don't just choke in it. So that's why I discourage everybody that is still learning from using it. Use your hand. Use your hand. If you have a stroke patient now, as from tomorrow, just put your hands on the patient's head and manipulate wherever your hands ended. If it's right leg or left leg or whatever side the stroke happened, just manipulate there. You can use pencil. You can use a biro. You can use a what do you call it? Massage pen. And you see what will happen. And then in this diagram, you see where other parts of the body. You of course you see the head, where the eyes is. All you need to do in neuro-acupuncture to be able to get your patient up in a short while. I tell you, this thing doesn't take time. In a short while, the patient will be able to do what he or she cannot do before. Now look at what I'm saying. Look at the next picture. Look at the next picture. The next picture shows you where the diaphragm is. The next picture shows you where the muscles are. All you need to do is you just go there and put your needle in that place, assuming the person cannot lift up his leg. The stroke is so much that person you're finding it difficult. You just put needles in that point where your thumb or your small finger is. Look at where the hip, look at everything. By the time we do this, our patient will be up and doing. So neuro-acupuncture, the effectiveness or the usage of neuro-acupuncture is still new. It's still new. It's just a few set of people or doctors that are that are really taking using it and making a lot of success, getting a lot of success the way it is. But let me tell you, you cannot say that you have really known knowing it all. No, it's something that with practice you really perfect in it. Then for you look at this other picture, the picture after the brain, after the head, the picture after the head is telling you that the brain has a lot of capacity. The brain has strength. And remember, we have never used our brain the way we are supposed to use it. The capacity of the brain is too much. So that is why if one part of the brain is dysfunctioned or have issue, move to another part. Go and learn the different parts that the brain has, the things that it can do. And then learn how to move to another part to get what you want. So the brain will not work until you, one, learn how to use it. It will not, because you're busy surrounding your stroke patient with supplements, medications, blah, blah, and all those stuff. And your patient is not getting well. But like I have said, just by this workshop tonight, if you have a stroke patient, just do one or two things that I showed you in these pictures. And I know you come back to say, doctor, that thing actually worked. And I encourage you equally to build on it, get to know more about other things that you can actually use neuro-acupuncture to do, because it has come to stay, and it's actually going to replace the traditional method of teaching of treating stroke patients, so that we can have a lot of stroke patients recovering in a short while. You use it, when you use neuro-acupuncture, you get perfected in it. So let's go to the next slide. I want to tell you 10 things that you must learn, 10 things that you must know about neuro-acupuncture. 10 things you must know is that one, you use it, you continue to use it. Like when people ask me, Gorgeous, how did you get to learn how to use acupuncture to do one or two things that that you're doing? I told them, I said, I practiced it. Yes, I went to a school where we were taught on how to use acupuncture for treatment. But then, if you don't practice it, you will not get skilled on it, or you'll not be perfect in it. That's the truth. You'll not get skilled in it because perfection is still coming. As long as medicine is, is you still have to learn how to. If you know this one, you still have to add to other things that you need to know. That's how this life is. So, but you must use it. The skill we don't practice often gets weaker. Yes, like I told you this night, I said, don't bother using needle. Don't bother using needle because some patients are even scared about needle. How much more when they see you wanting to put needle on their head, they are scared about it. Don't bother. So get your acupuncture pen, get your biro, get your pencil, go to your head, do what is called brain mapping, or even buy. In my office. I have a doll. Yes, I have a doll that I mapped. I did what is called brain mapping on. If you come to my office, you see it. I did what is called brain mapping on that doll. So what do I use it for? I just use it to see the areas I would use to treat a stroke patient or any other patient, because neuroacupuncture can equally be used to treat any other issue. Remember, it's every part of your body that is represented in your head. So it must not even be stroke alone. So get a doll and place your hand and put all these, the way you see it in diagram. Label it where the muscles is, where the feet is, where each part of the body is on the brain. When you have any patient, you just go there and tap, and you do it for at least 2 weeks, 3 weeks, depending on the case. But when it's for stroke, you don't stop. You have to do it consistently until you see that your patient has at least he has stabilized to the extent that his range, the way he can move his leg, the way his leg is stronger, his hand is stronger, his range of motion is sustained. So then you can reduce the episodes of treatment. Then the next one is use it and improve it. The skill we practice gets better. Specificity. We must skillfully practice the exact tasks we want to improve on. Yes, we must skillfully practice the exact tasks. I want to be an acupuncturist. I want to be a naturopath, because we cannot be jack of all trades. We cannot be jack of all trade. I know that a lot of people don't like acupuncture for all I care. But for me, I love it. I love it. I love acupuncture. I love homeopathy. I love it like anything. So I make sure that I give my time to it almost every other day. If you know me, some of my students are here. I don't even give time to naturopathy, even though I am a naturopath. I don't give time to it. I don't give the amount of time I give to acupuncture and homeopathy to naturopathy and other fields of medicine. So you must, because I want to know more. So we must carefully practice and the exact tasks we want to improve. Even in your patient, okay, today I was able to make sure that her range of motion, is increasing. So tomorrow I will take up the leg. I will do exactly what I was taught to do. And you see, each part of the body, before you know it, they keep getting better until the person is at least stabilized. Reputation matters. We must do a task over and over again once we've got it right to actually change the brain. Yeah. So if by simply going to the brain, I can treat my stroke patient, then why won't I continue to do it and learn it? Why won't I, finish taking care of this patient so that other patients will come? Intensity matters. More repetitions in a shorter time are necessary for creating a new connection. It's not the one you do today. Maybe in a day you just take it, you just you know do it for a short while. No, age matters. Younger brains tends to change faster than older brains, but improvement is possible at any age because why this is here, yes, when somebody is young, the rate at which the brain cell dies is lesser than when you're getting old. The brain cells dies faster in older people than in younger ones. So for stroke incidents, the chances of getting better results, could equally be achieved in a younger person than an older person, although the older person will still benefit or will still get better in one area or the other. Practicing one skill can result in improvement of a related skill. Practicing one skill can, yes, this is true. And please note, neuroplasticity is dependent on the experience and learning. This means repeatedly practicing helps determine how the brain will reshape itself. Are we there? Are we there?
Yeah.
Yes, ma'am.
Yes.
Neuroplasticity is dependent on the experiences and learning. This means that the skills or experiences you repeatedly practice helps determine how the brain will reshape itself. It's not where you do neuroplasticity on your patients today. Tomorrow you say, no, let's do another one. Or that go and be taking drugs. I am tired. No, no. And you know something, love heals. Love heals. If your patient sees that you have you're so concerned and you're going extra mile to do what is unusual, because this brain mapping and brain stuff is unusual, is an unusual treatment. It's an unusual treatment, sef, even amongst us practitioners. How much more, to the other world, to the general populace. So, but by the time your patient sees how eager you are to make sure that she uses that deformed hand, that deformed leg, to do what she originally was supposed to do with it, your patients will take the responsibility of her health into her hands, because she would even be disturbing you. Come, let doctor, come now, come and come, let's do this one. The one you did the other time, see what it happened. So see what it generated, see what it helped me to do, what it helped me to achieve. So I want to stop here for tonight, and thank you for listening. Is there any question?
Wow.
I know
Um,
I know that the course is new, but Dr. Daniel, please
yes, ma'am. I'm right here.
to give the slides to everyone here.
Oh la
No
la.
problem.
Thank you.
We shall make them available. So
Thank
we
you,
what
ma.
we
Thank you,
we
ma. God bless you. Thank you, ma. Thank you,
thank
ma.
you.
Doctor.
Mm,
Okay,
Thank
so
you,
what we
ma.
will
Thank you,
do
ma.
is we
my
shall
Thank
pleasure.
you.
open
Thank
the
you.
floor to those who have questions for Dr. Gorgeous. Do we have any questions? Okay. If you have questions, kindly indicate them in the chat. If you do not have questions, then probably we may just end the session here. Um, on that note, I genuinely
Okay, we have a question from someone, ma. A
Okay.
question from Miss Olaiton Miriam Ogundipe, and her question is, or she has two questions. Or the first, she says, "Thank you so much, ma. This is a lot of eye opener." Our first question is, what kind of doll can one use to do the mapping? And the second question is, she says she has a client about 3 years old, and his recovery in mobility stopped once he can use the staff to support himself. Every other treatment that he was given did not change his situation beyond that. Why is it so? And can acupuncture also help him? These are the questions.
Okay. Let me take the first one. When you go to that place that they used to sell these what do you call it? This model. That's the people that sews dresses. Those model that they wear. They used to display their sewn materials. When you go there, you will see you just buy. They sell it head, just the head of a woman or a man. I bought mine in the market, in the open market. So you see it, the head of a woman or a man is there. Maybe what I will do is I will snap when I get to the office. I will snap my own and then we'll put it in the WhatsApp group. Are you okay?
No
Hello,
problem.
Mr. Lighton. Does that answer your
Okay.
question?
Yes, ma. Yes, ma. Thank you, ma.
Okay. Then the second question, I advise that you start doing neuro acupuncture for that your patient. I advise that each time you revisit the case, do you understand, and start embarking on neuro acupuncture. Please, I equally advise that we should, if we really want to practice acupuncture, if you're here, I know people don't like acupuncture because they feel it's difficult, but it's more of practicals than theory. That is the truth, and that's why I love it. Not be too much grammar. I advise that these pictures these last pictures I showed you, especially this number 40 and 41 picture, I advise that you get your own done and do your brain mapping. It will help you a lot. So for that your patient, start off brain mapping on that patient. Look at the diagram and look at other every aspect of that stroke patient that still needs attention and work on it. By if you can needle, beautiful. If you can needle, fine. But if you cannot needle, just use what do you call acupuncture pen or pencil or whichever. Does that answer your question?
Yes, ma. Thank you, ma.
God bless you.
Thank you, ma.
Thank you.
Oh, good. Thank you very much. So we shall take the question from Madam Eze. If you would ask a question, please.
Thank you so much, Dr. Gorgeous. In fact, like my teacher, you have always been, you always prove yourself. I have a question, and my question goes like this. Yesterday, during our lecture on magnet therapy, I still asked a question where I asked Prof about someone with stroke, a stroke patient that has a blood clot on the brain, and it has taken time. And during his response, he said with magnet therapy, that if it has taken time, that the blood clot might not go out, but the patient can still be treated. So I also want to ask the same question with acupuncture and neuroacupuncture. If a patient that has taken time and he has a blood clot, can this neuroacupuncture remove the blood clots? Thank you.
Okay. I will still answer you the way Prof answered you. Remember I said when you wake up in the morning, you don't have stroke. You're just okay.
First thing you should do is put your hands on your head and remember massage. When you massage, you're opening up blockages. You're moving things that are not supposed to be there. So I think by neuro-acupuncture, the blood clot can be cleared, but not immediately. It's not something you expect to be done, instantly, but gradually you're moving the space. But remember, you're just what you're doing is trying to knock on another door to open for you. This other door is closed. You're trying to knock on another door. So trying to open other doors would make this other one to be minimized. Do you understand what I'm saying?
Yes, ma.
Trying to because you're going through the neural pathways. Remember, it's not only one neural. There are so many what do you call it, that makes up the neural nerves that makes up the neural. So in the particular place where the blood clot is, it might not be able to use acupuncture to remove it. But let me tell you, I equally bleach the head. Do you understand? Because in acupuncture, we have what is called cupping. We have what is called cupping. The head can equally be cupped.
Are you saying we can use cupping to remove
Yes.
the in the
Yes.
head?
Yes, that's what I'm saying. Yes.
It's okay.
Yes. I bleed the head depending on the area. So you can. But remember, I said something. Remember that I said that whatever you do, you should be careful about it, and you should be you should have learned it very well. There are tiny cups that you can use and just puncture the head, but small puncturing, and put your cup there to suck out.
You're talking about wet cupping or dry cupping now?
No, this is not wet cupping, no, please. It's still dry cupping now.
Okay, thank you.
Any other question?
Right. So I believe there's a name, Ochuko, who has a question. If the person would like to proceed. Hello, Mr. Ochuko or Mr. Chuko. Are you there? If the person is not responding, then perhaps we can go for the next name on the list, which is we have a name, Mr. Faremi. If you are here, sir, please proceed with your question. If we are not hearing from Mr. Faremi, then maybe Oge can proceed with our question then.
Good evening, Doc. Thank you for this wonderful exposition. I am really proud of you as my teacher, and I'm proud to be a student of yours. Thank you very, very much, Ma. I must say that I'm so pleased with this exposition. My question is, number one, if you are to do acupuncture or cupping on the head, do you need to scrape off the hair? That is number one. Number two is for someone that has been, maybe one limb has been affected because of a stroke. for a long time, can it be revived? That is number 2.
Okay, let me start with the number 2. It can, but remember I said it will not be like it would have been when the stroke was new. It's going to take time. It can. It can. Your ability to make your patients to one believe and then be consistent with the treatment equally matters. But they can, because the pathway you're following and you have never followed it before. You've not used it before. So what you do is still revisit that patient and say, okay, come, there's this new way I want to look at this thing. It can. You've not used the brain now to do anything before. You were just doing Adichie point treatment and what have you. So it can. That's the second question. What's the first one?
And scraping of the hair.
Yes,
And
of course you have to. Of course you have to. You have to.
Okay.
You have to. That
Number 3.
particular area. Because I even know of somebody that had she's not my patient, but she's just a friend and a daughter. She had fibroid, and after having fibroid, she had fibroid operation. After the fibroid operation, before you know it, she had a stroke episode. Since that's about 2 years ago or so, and each time she will say that this thing is her head is giving her issues. One doctor, I don't know where they say the doctor comes from, will come to her head and drain out blood and carry. And the doctor has done it nothing less than 20 to 30 times. Now, here we know if you're an acupuncturist here, there's something that we call someone that has bad blood in the system, whether in the leg or hand or whatever. You know that,
Letting.
yes, bloodletting. So, like I said, when you are doing it in the head, it's just a question of that area that had that issue. You just do a little tapping there and put your cup. Remember what you're doing. Remember why you're using cupping is to be able to, when you remove the cup, expand the blood circulations to every other part of the body, so that oxygen will do what? Oxygen will penetrate everywhere. So the same thing you can do to this one. Just
Thank
small.
you. Number 3 question goes like this. Apart from massaging the head, generally during when you have a stroke patient, you still do your normal massages and all of that. Now, what is the best analgesic that should be or will be given to the patient to reduce pain, because the pain is too much, and because of the pain, self, it can even cause more problem. They can even have trauma. Even seeing you alone, self, it can.
LI4.
Okay,
LI4.
Okay, thank
LI4.
you.
LI4.
Thank you.
You do your normal Adichie LI4 point. Of course, you know where to do LI4.
Yes, ma. Thank you, ma.
LI4 every time
Thank you.
there is pain.
Thank you, ma.
Great, ma. Thank you very much. So we will take the 1 or 2 more questions before we round up the night. We have a question from a person, Olusegun Faremi. The question is, how safe is the fine needle and the place of hygiene in the acupuncture practice?
The fine needle is safe. It's safe. Remember, before you use the needle, you have to you have to use your, what do you call it? Use your spirit. The fine needle is safe and fine the way you heard it. We have different kinds of needle. We have the dry needle, we have the particular regular needles. But the one you are using for the brain is the dry needle. It's not this other regular needles, because this dry needle is, is very flexible and small. So it's not as far a big one that like the other one. But whatever, you sterilize the needle before you use. So it's safe. The injection they used to give you in the hospital, how safe is the needle they used to give you in that injection? Eh? I'm asking Mr. The person that asked the question, you know. So it's very safe.
I'm
Make
not
sure
sure if
you
it's still.
make sure you sterilize your needles before you use.
Good evening, ma.
Thank you.
Yeah, good evening.
Good evening.
Yeah, thank you very much, ma, for this session. I
Thank
have a question. Okay, my name is God's Gift. I have a question.
you.
Um, okay, before now, I've actually heard of acupuncture, but I think today's class really kind of opened my eyes to some things I didn't really know about. Because to be honest, this week was actually the first time I'm actually hearing of this school and everything that has been done. So most of the information I'm getting this week are kind of information that are kind of new. So some time back, I've seen someone who it showed me something in his house, and he called it an acupuncture kind of like a mat. So every morning he would wake up and step on it and put his leg on it, just like a treadmill, but he'll be matching it. And when I asked him, I was like, "Oh, this is acupuncture." I'm like, so you're matching it." So after when he finished, I decided to try it. So I started matching this thing to it. It was like needle, but it was just pinching my leg and all that. So I did it for like 5 minutes, and when I was done, I discovered that I was just feeling different. So I was like, from what you were saying now, you are talking about needle on the brain. Now that one is on the leg. Is it the same thing?
Yes. Like I've always said during this class, I said every part of your body is represented on the head, on your hands, and under your feet. Do you understand? Yes. So it's still the same things. Straighten. You can equally actually treat the brain too from your leg.
Wow.
If you look at that, there's this diagram I dropped there where where they were swimming. You understand? I have one that has the flexology. That is, flexology is the representation of your bodies on your feet, under your feet. So if you have issues or your patient has issues, you can just pull up the person's feet and massage, or use needle, or use biro, or use pencil, anything you want to use that area, and the person will simply get well. It's just like that too. See, let me tell us practitioners. I used to tell my students, I said, what you don't believe, your patient will not believe. If you know the faith that made you before you came into this practice, that faith or courage or whatever that made you to always go to hospital and believe in their practice and everything, you need to do double of it. You need to do a U-turn and equally add the same faith and a greater one in this practice, with the acupuncture, with the homeopathy, with the naturopathy, as long as you are a complementary and alternative medicine practitioner or lecturer or whatever you're doing in this field, doctor, you need to believe in yourself. You need to believe that whatever you're doing must work, because you're the first patient of yourself. So if you don't believe it, honestly, your patient will not get healed. That is the truth. As simply what I tell my students. Do you believe? Yes, ngwa, go. And it will work. I've seen it countless times works. Okay, my battery is going.
Thank you, ma.
Just
God bless.
lights. Any other
Thank you very much.
question?
So we will take one last question from Adebisi Adeyemi. And we had someone who was asking a question that is for the college. Is the acupuncture course available? Yes, it is available, but we will discuss admissions and everything probably tomorrow evening after tomorrow's session. But we are not discussing that tonight. Thank you very much. So we will go for the next question from Mr. Adebisi Adeyemi. Please proceed with your question, sir. Okay, if the person is not going to ask their question, then we have another name, Tolulokpe Adebayo. Do you also have a question? Okay, well, if these folks would not be asking questions tonight, then I think what is left for us to do is to show our appreciation to Dr. Gorgeous. Thank you very much, Ma, for such a clear and practical session. I believe you've shown us that recovery doesn't have to be complex. A person or a practitioner just requires the right tools and apply the right skill. You've explained acupuncture, different forms of therapy. You've talked about yoga. You've given us a glimpse into how natural therapies can be powerful, structured, and result-driven. So we appreciate your time. Thank you very much. We appreciate your expertise and the care that you bring to your work. Thank you once again, madam. Thank you, Dr. Gorgeous. Thank you very much. And thank you everyone for being part of this session. We hope you've enjoyed it. We hope you're enjoying this workshop so far. And we can't wait for tomorrow's sessions with Professor Husseini. We will talk about yoga, with a lot more emphasis on yoga and chakra healing. So this is it from my hand. We will stop right now because time is running late. Thank you very much, Ma. Thank you so much.
Thank you. I appreciate you. I appreciate everyone. It's my pleasure. My pleasure. It's my pleasure. Thank you.
Thank you,
Have
ma.
a good
So much. Thank you, ma.
Thank you, ma. God bless you.
Thank you, ma.
Thank you, everyone. Good night.
God bless you,
Good night.
ma. Thank you so
Good night.
much, ma.
Good
Thank
night.
you, ma.
Thank you, ma. Good night.
Night.
Good night.
Night, ma.
Good night.
God bless you, ma. Jane. Jane.